Red alerts with not a single ambulance available happened 3,324 times, where that entire region from Strathmore to Kananaskis and from Red Deer to probably Coaldale didn't have a single ambulance available anywhere.
That's the voice of paramedic Ryan Middleton. He requested details on paramedic response through Alberta's Freedom of Information request, and he shared it with City News.
When we're talking about that red alert, that means by the time Calgary has already used its 40 ambulances and pulled in all of the surrounding resources, it still has been left with zero, sometimes for up to 23 minutes at a time.
The stats also show Calgary having over 36,500 orange alerts. That means only 1 to 3 ambulances were available during that time to respond to calls. If we broke it down by the 366 days we had last year, that means we had around 9 red and 100 orange alerts each day. Other documents also show units from AirG were redeployed to Calgary 881 times in 2020 and 474 times in 2021 so far. Those same AirG units are also responding to more calls outside their area, meaning in Calgary and other places in Alberta.
This is an inequitable access to emergency services for Albertans who are all paying an equal amount in taxes to the province, with the expectation that an ambulance will be available to them during their absolute worst moment when they call 911 and expect to receive help.
Middleton also notes paramedics spent over 100,000 hours waiting with patients in hospital last year. If we consider the average shift of 12 hours, that means over 8,362 full 12-hour shifts were spent by EMS waiting with patients in hospitals. But Alberta Health Services tells City News EMS continues to see unprecedented and historic increases in calls, also arguing red alerts only last a few seconds up to a couple of minutes, adding they've been hiring more paramedics over the last 2 years and the pandemic has been extremely challenging. In Calgary, Safe Kaiser, City News.